Hey everyone, and welcome to a deep dive. This one is designed for all you nursing students out there.
Right.
We're going to be tackling COPD care today, but not just the surface stuff. We're going to be going for those aha moments that are really going to help you in clinicals and beyond.
It's such an important topic. I mean, you're going to encounter COPD patients everywhere in your nursing career.
Mhm.
So getting a good grasp on all the nuances now is really going to pay off later.
Okay, let's dive right in. One thing that really struck me when I was looking at all the materials is how much emphasis there is on doing a really thorough patient history. It's more than just asking, do a smoke and moving on.
Right. Absolutely. It's
Yeah.
about being a detective,
Right.
and uncovering the story behind the diagnosis. I mean, for example, imagine you have two patients with COPD, and both of them have a smoking history, but one of them worked in a coal mine for 20 years.
Okay.
That detail completely changes how you approach their care, their potential complications, everything.
Wow, I never even thought about it like that.
Right.
So we're looking for those hidden clues, those details that might not seem that important at first glance.
Right. And then there are the symptoms. I mean, you're going to learn about dyspnea and cough and sputum production, all that fun stuff. But those are just words in a textbook.
Yeah.
In real life, you need to understand how the symptoms are impacting your patient's life. Can they walk up a flight of stairs without gasping for air? Can they sleep through the night without that nagging cough?
Yeah.
Those are the things that matter.
Okay, so we've got that detective work of the patient history and then the real-life impact of symptoms.
Yeah.
And then the materials start bringing in all those technical terms like ABGs and PFTs.
Yeah.
I'll be honest, I still get a little intimidated by those.
I hear you. But remember, those numbers are just a way to quantify what's happening in the lungs. I mean, think of it like this. Your patient is basically breathing through a straw instead of a garden hose.
Okay.
The FEV1 and FVC values that you get from the PFTs tell you just how narrow that straw's become.
Mm-hmm.
And if that FEV1 FDC ratio is less than 70%, okay.
Well, that's a pretty narrow straw.
Yeah.
And it means that their airflow is significantly limited.
Okay, that analogy actually makes a lot of sense. So it's not just this random number.
Yeah.
It's a measure of how much their breathing is actually affected.
Exactly. And the ABGs. Think of those as a snapshot of how well their lungs are doing their job. Are they getting enough oxygen in? Are they getting enough carbon dioxide out? Are they maintaining the right acid-base balance? Those numbers tell a story.
Okay.
And your job is to learn how to read that story.
Okay, I'm starting to see the light.
Hmm.
So we've got the story from the history and symptoms, and then we've got the hard data from the ABGs and PFTs. Now, how does the nursing process fit into all of this?
The nursing process is your roadmap for taking all that information, the story, the numbers, the things that you observe yourself, and turning it into a plan of care.
Okay.
Imagine you walk into a patient's room, and they're using all those accessory muscles just to breathe. Their lips are blue. They're clearly anxious.
Oh, wow.
That's the first thing you do.
Well, I'd want to check their O2 stat right away.
Make sure they're getting enough oxygen.
Exactly. And those observations would lead you to nursing diagnoses like impaired gas exchange or ineffective breathing pattern.
Uh-huh.
Each diagnosis should flow naturally from what you're seeing, what you're hearing, what you're assessing.
So it's not just about memorizing a list of diagnoses. It's about connecting the dots between what you observe and what's actually happening with the patient.
You got it.
Oh.
And remember, each patient is unique. What might look like impaired gas exchange in one patient could be more about activity intolerance in another,
Wow.
even if they have the same underlying disease.
This is really making the nursing process come alive for me. One diagnosis that I found really interesting was anxiety. It makes sense. If you can't breathe, you're going to be scared.
Right.
But how do we break that cycle as nurses?
That's such a crucial point, and honestly, one that often gets overlooked. First and foremost, your presence as a calm, reassuring nurse can make a world of difference. I mean, imagine yourself in their shoes.
Yeah.
Struggling to breathe is terrifying.
Yeah, for sure.
So just being there, explaining what's happening, offering support can really help to ease their anxiety.
That makes so much sense.
Yeah.
But it also feels like a lot of pressure. Like, what if I say the wrong thing?
It's understandable to feel that way, especially as a student. But remember, you don't have to be a therapist.
Okay.
Simply acknowledging their fear, saying something like, it sounds like you're feeling really scared right now,
Yeah.
can be incredibly powerful.
Wow. I never realized how much of an impact just listening and validating can have.
Mm-hmm.
This is totally changing how I'm going to approach patients in clinical.
That's what we love to hear. And remember, there are always other resources you can connect them with, like respiratory therapists, social workers, or even support groups.
Right.
You're part of a team, and you don't have to shoulder everything yourself. And speaking of teamwork, Let's move on to some of those practical interventions that you'll be using as nurses. These are the hands-on skills that can really make a difference for your patients.
Yes, I'm ready to get into the nitty-gritty. So in the nursing student materials, there's a lot of focus on breathing exercises. And I have to admit, when I first heard about pursed lip breathing, I thought it sounded a bit hokey. Does it really work?
It absolutely does. And it's all about physics. I mean, think of it like blowing out a candle slowly.
Okay.
You're creating resistance, which helps keep the airways open longer and prevents air trapping, which is a big problem in COPD. It's like creating a back pressure. That helps those tiny air sacs, the alveoli, stay inflated.
Okay, that makes a lot more sense. It's not just about making a funny face, it's about manipulating the airflow.
Yeah.
And what about incentive spirometry? I've seen those devices around, but is it really as simple as it looks?
It is pretty straightforward,
Yeah.
but like any technique, there's a right way to do it. You're basically breathing deeply into the device,
Okay.
which encourages those alveoli to expand fully. Think of it like giving your lungs a good stretch. It's especially important after surgery or if a patient's been inactive for a while.
So it's like a workout for the lungs. Speaking of workouts, what about coughing? I know that effective coughing is really important for clearing the airways, but how do you teach a patient to do that without making them feel awkward?
There's a technique called huff coughing
Okay.
that's gentler than a forced cough. Imagine trying to fog up a mirror with your breath.
Yeah.
That gentle force is similar to a huff cough. It helps loosen mucus without straining the patient.
Okay. I love that analogy.
Yeah.
It's so much easier to picture than just saying huff cough. And the materials also talk about positioning. How does that play into effective coughing?
Positioning can make a world of difference. For example, having the patient lean forward with their arms supported can help them cough more effectively. It's all about using gravity to your advantage.
This is all starting to feel like a puzzle where all the pieces fit together. The breathing exercises, the coughing, the positioning.
That's a great way to think about it. It's all about finding the right combination of interventions. That works for each individual patient. Now, speaking of interventions, let's tackle the big one, oxygen therapy. Now, I know in the nursing student materials, there's a lot of emphasis on the risks of oxygen in COPD patients. It seems a bit counterintuitive. Like if someone can't breathe, wouldn't you want to give them more oxygen?
Right. That's what I thought too. But then there's all this talk about the Haldane effect and oxygen-induced hypercapnia. And honestly, it's a bit overwhelming. Can you break it down for us?
Of course. So remember we talked about ABGs earlier? Well, in some COPD patients, their body actually gets used to having lower oxygen levels and higher carbon dioxide levels.
Right.
Their drive to breathe is actually triggered by those low oxygen levels. If we suddenly give them a lot of oxygen, it can knock out that drive to breathe, leading to a buildup of CO2 in their blood. That's the hypercapnia.
Okay, I see. So it's like their body gets too comfortable with the high CO2 levels.
Okay.
The oxygen throws things off balance. But the Haldane effect, that one still kind of confuses me.
Imagine a crowded train where the seats represent hemoglobin in the blood.
Okay.
Oxygen molecules are eager passengers, and they tend to push out the carbon dioxide riders, making it easier for them to exit at the lungs.
Okay.
That's the Haldane effect in a nutshell. More oxygen means less CO2 hanging around.
Wow, that analogy makes it so much clearer. So it's not that oxygen is inherently bad for COPD patients. It's that we have to be really careful with how we administer it.
Exactly. It's about finding that sweet spot, enough oxygen to improve their oxygen levels, but not so much that it suppresses their breathing drive.
This is definitely a case where too much of a good thing can be bad. So how do we find that sweet spot? The nursing student materials mention different ways to deliver oxygen, like nasal cannula, mask, all sorts of things. How do you choose the right one?
That's where your assessment skills come in. You'll need to consider the patient's oxygen needs, their comfort level, and whether you need to deliver a precise concentration of oxygen. A nasal cannula is great for low-flow oxygen, while a Venturi mask lets you control the exact percentage of oxygen being delivered.
So much to think about. Sounds like oxygen therapy is almost an art form.
It is in a way. It requires careful monitoring, critical thinking, and a good understanding of the patient's individual needs.
Well, this is a lot to process, but it's also super interesting. It makes me realize how much responsibility we have as nurses, especially when it comes to something as essential as oxygen.
You're absolutely right. And that responsibility extends beyond just the technical aspects of care. Remember, we're caring for human beings, not just lungs. Let's talk about how we can empower patients to manage their COPD on a daily basis.
Okay, so we've covered a lot of ground here. From that detective work, the patient history, to the nuances of oxygen therapy. But something that really resonated with me in the nursing student materials was the emotional side of COPD.
Hmm.
You know, it's easy to get caught up in all the physical aspects, but we can't forget about the impact this disease has on a person's mental and emotional well-being.
That's so true. I mean, we've touched on anxiety a bit, but the materials also highlight depression as a common issue for people living with COPD. It makes sense, right? When your world starts shrinking because even simple activities become difficult,
Right.
it's easy to feel hopeless and isolated.
Absolutely. And it's not just the patients themselves. Their families and caregivers are going through this too.
Yeah.
COPD is a chronic illness, and it demands constant support and understanding from loved ones. I mean,
Yeah.
they're in this for the long haul.
Exactly. We have to remember we're caring for human beings, with complex lives and emotions, not just a set of lungs. That means recognizing and addressing the emotional and social aspects of COPD alongside the physical.
I'm hearing you loud and clear on that,
Yeah.
but honestly, it feels a little daunting. Are we expected to be therapists now too?
Well, we're not trained therapists, but we are trained to be compassionate and attentive listeners. Sometimes just acknowledging a patient's feelings, their frustration, their sadness or fear,
Yeah.
can be incredibly validating. It shows them that you see them as a whole person, not just a disease.
It's about creating that safe space for them to open up and share what they're going through.
Precisely. And then we can connect them with additional resources if needed, whether it's support groups, counseling services, or even just information about coping strategies. We're there to guide them, not to have all the answers ourselves.
So it's about empowering them to take care of their mental and emotional health just as much as their physical health.
You got it. And remember, self-care is crucial for nurses, too.
Yeah.
Dealing with chronic illnesses day in and day out can be emotionally draining. So make sure you're taking care of your own well-being so you can be there for your patients.
That's such a good point. You can't pour from an empty cup.
Right. Okay, I think we've covered just about everything on COPD care. Any final words of wisdom for our future nurses out there?
Sometimes nursing school can feel overwhelming,
Yeah,
especially when you're faced with a complex condition like COPD.
yeah.
But remember, you're learning the foundations. You're building the skills to become incredible nurses. And the most important thing you can bring to the bedside is your compassion, your curiosity, and your willingness to learn. I love that. So it's not about having all the answers right away.
Yeah.
It's about being present, being engaged, and never losing that desire to learn and grow.
Exactly. And remember all those practical tips we talked about? Pursed lip breathing, huff, coughing, recognizing those red flags like an FEV1, FVC ratio below 70%.
Right.
These little nuggets of knowledge might seem small, but they can make a huge difference in your practice.
This deep dive has been amazing. I feel so much more prepared to face COPD in the clinical setting. It's a challenging condition, but it's also an opportunity to truly make a difference in someone's life.
Couldn't have said it better myself. And remember, each patient is unique, so stay adaptable and always advocate for their individual needs. You've got this.
To all our future nurses out there, thanks for joining us for this deep dive into COPD care. We hope you learned some valuable insights today and feel more confident about tackling this complex but incredibly rewarding aspect of nursing.
And remember, learning never stops. Keep asking questions, keep seeking knowledge, and keep striving to be the best nurses you can be. We're all in this together.
That's it for this deep dive. We'll see you next time for another fascinating exploration into the world of nursing. Keep learning and keep caring.